One thing I wanted to ask is that, so basically you kind of predicted the pandemic in this book. You said that you actually did a bet with the Mr. Pinker. That was $1,000. And did you win that? Or?
Well, it's interesting because I had the bet and that there would be a pandemic with 1 million casualties. And of course, the actual COVID-19 has been far worse than that. But I may lose the bet because I said in my bet that I thought the pandemic would be not a natural one, but an engineered one. And although, of course, some people think that the virus leaked out of the lab in Wotan, I don't think most people believe that. And so technically I'm going to lose my bet with Stephen. On the other hand, I think he has learned the lesson that we can't be so optimistic about the future because something far worse than he envisaged has actually happened naturally.
Yeah, I mean, the investigation is going to be complicated there, but do you think it really matters, or do you think it's important to investigate on what really happened there, if it came from animals, or if it came from a lab, or if it came... Do you think it's relevant at all? Or?
Well, I certainly think it's important. I mean, the most likely thing is it did come from animals, and if that's the case, then it's hugely important to minimize the sort of situations in those markets of live animals, etc. Because most of the experts think that as the world's getting more crowded, there's going to be more interaction between animals and humans, and that the risk of the transfer of viruses between species is going to grow. So I think it's very, very important to do all we can to minimize that sort of transfer, because most of the experts think that if we don't, then the probability of these pandemics is going to get higher and higher. And of course, let's not forget that they could be far worse than the present one.
And I guess there, I mean, if it came from a wet market, then the solution is simply more hygiene. Just avoid those bad conditions, stacking the animals on top of each other, if it came from a wet market.
Yes, or maybe something more drastic. Yeah.
Or close them down. And yeah, so you spoke about, before you spoke about a short-term perspective from politicians and so on, also probably from the media. And one thing I wanted to discuss is that, I mean, I was looking at the statistics of deaths worldwide. And so from the pandemic, we had, and that at least that's the reported one, about 1.8 million people died with the COVID. But then there were also 1 million suicides, and there were 8 million deaths due to cancer. So it seems that, why do you think we don't give enough attention to long-term problems like cancer and so on? Because, I mean, this is a far bigger problem, I think.
Well, I mean, I disagree. I think there's a huge amount of research on trying to deal with cancer. It's a very intractable problem. They haven't made tremendous progress, and it's part of which people are living longer for other reasons. And I would actually say that if we think of the balance of medical research, there's not enough being done on tropical diseases of the poor, and because the number of children who die from infectious diseases in Africa, I don't know what the numbers are, but that's in millions per year. And so I think we certainly need to deal with all these diseases, including cancer, but I think they are much more difficult to deal with. And I think the effort of medical research is pretty strongly focused on cancer, isn't it, at the moment?
Okay, yeah. And then there is a problem of suicides, which is another problem. The suicides are increasing, especially now with all the psychological problems that this pandemic has created.
Yes, yes. Well, I mean, I think that's fully understandable, because, of course, the pandemic has not hugely affected people who can work from home, etc. But those who are forced to go out and risk dangers and who are living in cramped apartments, they've had a really, really bad time. And if they've got children, it's understandable. And this is just an example of how mental health and greater equality are two things we don't prioritize enough. And we need, in particular, to reduce inequalities. In fact, one of the lessons which I hope will be learned from the pandemic is that the people who really matter in a crisis are delivery drivers, health workers, and people like that. And they are the people whose jobs are insecure, who will get low status, and they ought to be raised. So I think the inequalities, which are far too great within countries as well as between countries, need to be reduced. And I worry that in this country we are not moving fast enough in that direction. And of course America is even worse. And I think we should realize that we in this country can learn far more from Scandinavian countries than we can from the United States in terms of a better social system, because for mental health, people have to feel secure and valued. And that is not happening in this country or in America, but it's happening more in the Scandinavian countries. And when there are sort of attempts to measure, or on the basis of opinion polls, general happiness and contentment, then I think Denmark comes out as number one. And Britain and America are much lower, but the Scandinavian countries come out top. And that's because they have public services, they accept high tax rates to provide a good welfare state, high quality services for everyone, and avoid excessive inequalities. So that's the way we need to go.
And do you think we should have a universal basic income?
Well, I mean, something in effect like that. I mean, I think everyone who can work should have to work. But I think what we should have is very large numbers of dignified, well-paid jobs, paid for by the public sector, for instance, carers in old people's homes, assistants for teachers and things like that. Because the people who are going to be put out of work by AI in the short term are people who work in Amazon warehouses, in call centers, etc., which are fairly mind-numbing jobs anyway. But what's needed is that the companies that own those robots should be heavily taxed so that the government can fund large numbers of properly paid jobs for carers, gardeners in public parks, teachers' assistants, the kind of jobs where being human is important and where there's a huge undersupply at the moment. So that's the kind of thing that needs to happen. And so this would not be giving people an automatic wage, but it would be giving people the opportunity of jobs which are socially beneficial and satisfying, and also would be producing a sort of welfare state so that the everyone was kept above a much higher level than the rather vestigial welfare state does at the moment. So it just means a higher taxation. So the mantra of low tax economies is, in my view, a very damaging one. We should accept that we need higher taxation.
And you said that the wages of so-called essential workers should increase.
Yes.
But also during the pandemic, we had a huge problem, which is the sort of destruction of small businesses in favor of a big corporation like Amazon, for example.
Absolutely. Yes. Yes. And of course, what's outrageous is the very big corporations, because they're multinational, they famously don't pay anything like their fair share of taxes. And so it's the tax from them which could make a huge difference in helping small businesses, but also in producing enough jobs to meet the need in care homes and in schools.
So I wanted to go back a little bit about policies and prevention and all these things. What do you think we could have done in order to avoid this pandemic?
It's not clear. I mean, it would have been worth spending a lot of money if we could, because the pandemic is going to, over the next few years, have a total cost for the world, which people have estimated at least $20 trillion. And even if you think the probability was only once per 50 years, that means that if you work out the insurance premium by multiplying probability by impact, it would have been worth spending several $100 billion in order to reduce it or eliminate it. And that wasn't done, and that's a lesson we've learned. I suppose what we could have done is been better prepared to produce vaccines for the coronavirus, as we had done, incidentally, for influenza virus. The British had stocked up on vaccines for a flu pandemic, but not for this kind. And they also hadn't taken account that this kind of pandemic required lots of protective clothing for medical staff, and it might be hard to develop a vaccine. So things like that. But also, of course, if you think of what the World Health Organization could do, if one could have a more effective monitoring program, so that, again, I say this in my book, so that a Vietnamese farmer immediately notices and reports any strange disease in his flock, etc., and there are ways of monitoring these newly emergent things to catch them before they spread to humans or spread very far, then that would be better, and it would clearly be worth having a far more scaled up program to do that sort of thing. I mean, these are fairly sort of obvious suggestions, but it's clear that if you think of the costs of a pandemic, it's worth spending a lot more in trying to mitigate it or prevent it. And given that pandemics often start in remote places, on farms, etc., then having a more efficient way of ensuring that they are stopped near the source, as it were, before they spread, would clearly be good value. So that's just one example.
Thank you for listening to this conversation with Professor Martin Rees. So if you enjoyed it, please leave a comment below, like, subscribe, turn on the notification bell, and support this channel on Patreon. This podcast is also available on Spotify and Apple Podcasts. You can find the links in the description below. Thanks for watching.